The UK has sparked debate by suggesting a solution to coronavirus, that is, herd immunity. It is the only country publicly exploring this approach. Herd immunity is where enough people in a community get infected by the virus and then develop a natural capacity to fight it, ultimately stopping its spread. Here's an example. Let's assume that in this group of 10 people, 8 are vaccinated and 2 are not. Because the 2 are separated by a herd of 8, the virus won't get to them because the chain of transmission is broken.
We are clearly now stopping the contain phase of this operation that we've always said from the beginning. There were 4 stages to this: contain, delay, research and mitigate, and the contain finishes from today.
But the government is banking on people getting infected with COVID-19 and developing immunity.
This is one of the big problems with this idea of herd immunity as a strategy to combat the pandemic, because it doesn't really combat the pandemic. This is just sort of allowing the virus to take its natural course, and this is what the sort of end point would be if we didn't really do anything about it. But first of all, we don't know exactly what the transmissibility of this virus is. We don't know what kind of immunity is developed to this. We don't know how long the immunity lasts. So there are many unknown things.
According to British government's chief scientific advisor, in order to reach herd immunity, about 60% of the UK's population would need to get ill and become immune. With a population of approximately 68 million people, it means around 40 million people need to be infected in the UK. Current global estimates are that COVID-19 has a 2.3% case fatality rate. If we go by this rate, then UK's COVID-19 herd immunity could result in the deaths of a nearly million people, with a further 8 million severe infections requiring critical care. That's a huge number that could put the country's National Health Service under huge strain. Experts also don't know how long it will take for this 60% population to first get infected and then second, to recover from it.
If we don't get a vaccine, eventually we should get to a point of herd immunity. And if you can slow the spread so that you protect the most vulnerable portion of the population, then maybe you can reduce the overall deaths. And, there is an argument for that. But I think overall, it's a very dangerous strategy because, for instance, as you're seeing in South Korea, they're starting to get the outbreak under control without having to reach herd immunity.
The World Health Organization has emphasized that the best approach is containment rather than mitigation.
You can't fight a virus if you don't know where it is. Find, isolate, test, and treat every case to break the chains of transmission.